Hi guys, my name is Josh Shekatan. I used to work for Abercrombie back in high school and freshman year, but I'm not going to be talking about that. It was a pleasant workplace. Just had the full clothes and clean up after changing rooms, and that's usually the worst. I want to be an anesthesiologist. Can you imagine going through surgery and feeling like the scalpel cutting you open and...
My friend actually has to do that because he's allergic to anesthesia.
There's no alternative for him? Alright, I'll look that up. Imagine just, like brain surgery or something like that. Like, imagine feeling someone inside your body and you have no control over it. Anesthesiology has been created since 300 BC by the Chinese. In 300 BC was like the first time a surgeon actually used some anesthetics for, I believe he was practicing on animals. He was like opening them up, seeing how they operate. Anesthesiologists usually work in hospitals, clinics, and pain treatment centers. They usually work very long hours. They don't really spend too much time with the patients. They usually spend most of their time filling out paperwork, making sure it's the right medicine. They're doctors who give out gases, drugs, so people don't feel the pain during surgery. The work conditions, as I said, they obviously work indoors, usually 100%, most of the time. They work in very clean, sterile environments because obviously they're working with things that are going inside your body, and you want them to be working in a sterile environment. Obviously, like an operating room or emergency room. They work. Sometimes they can work up to 70 hours a week, and they're always usually busy. So to get to that spot, you have to do 4 years undergrad, anywhere, bachelor's degree, and then you have to take MCAT exam, score high on it, and then you have to get accepted to med school. Hopefully it's in American med school, or if you go out to Caribbean islands, it's kind of hard to find residencies unless you match really high. If you score really high on the board exam, only then you'll be able to get residency. But if you're like just cutting edge, just average, you won't really get a residency, and you'll be waiting for a couple of years to get your residency. You'll be just sitting there because you cannot practice medicine without specializing. You can after 4 years, so you do 2 years in the actual school, and then you do 2 years rotations, and then after your rotations you're MD, but you didn't specialize and you didn't do any residency yet. So you're technically MD, but you cannot practice anywhere. So then you do residency. It depends on what kind of residency you want to do. Some residencies are 3 years, some are 2, some are up to 8. And then after residency, people do fellowships. And fellowships are sometimes 2, could be 3 years. And then even then, someone will do 2 or 3 fellowships on top of that. So they'll be specialized in 3 or 4 different things. As I said, so as soon as you're out after those 4 years undergrad, 4 years med school, you become the MD. Then you're gonna do residency. So some residency you can specialize. You'll be, it's on the next slide, but as soon as the more experience as you get and more you specialize, with the years of training you have, your paycheck gets even bigger and bigger. Your first year you make 140, and then after 2 years of residency or fellowship, you make 320. That's the average. That's an average. So let's say you went out to like pretty much Idaho, Minnesota. That could be $700,000 to $800,000. Actually, my cousin worked on was it Aaron who had surgery on it? I believe it was Aaron who had surgery on his leg, and he helped with his surgery with this famous doctor in Atlanta, and he's working in Atlanta right now, and he told me that he's making like 1.2 right now. And he doesn't have his own practice or anything. He's just working in the hospital, and he's doing little things on the side. But he's 1.2. Yeah, and then after, like I said, so you can after you become an anesthesiologist, you could even go into you can be a surgeon, which is even more schooling, and you get paid even more, obviously. So obviously, you know, there's more people, the population is getting bigger, and the aging population is also getting bigger. And now with the healthcare and everything, it's expanding the age of life expectancy. Yeah, thanks. So, you know, there's older people now, and you know, they get a lot of surgeries and things done. So they definitely need us. Usually English skills, you know, filing paperwork, making sure it's right, communication skills, well, perfect for this class. You know, talking to patients, talking to staff members, getting what you need. And of course, the job is demanding, schooling is very demanding, but once you're out, you can enjoy it. You might have white hair or no hair, but you have enough money to put some new hair in there. Any questions?